Hello everyone, welcome to Pediatrics by Dr. Anand. This is a beautiful Unacademy NEET PG platform, and now it's 12 o'clock, the second half of our image-based revision. In the first half only, we had some 500 students. In the second half, let's see how many are coming. And there's a beautiful segment. We're going to talk about some amazing image-based questions and some amazing stuff. Starting with this one, my name is Dr. Anand. In the beautiful Unacademy NEET PG platform, the first I recommend everyone is to give as many tests as possible. It will be amazing if you give as many tests as possible. This is the month of the April to 24th. Basically, we have some amazing anat, biochem, anesthesia, so many amazing test series we have. I recommend every one of you to give as many tests as possible. Okay, great. So hello Vaidehi, hello Nishi, hello Swaraj. Let's start. And also on the May 1st, we have this All India mock test, which is happening at 9 a.m. So I want you guys to give this mock test. Previous mock test also, we have amazing, students who have participated with amazing prize distribution. So I want you also to give this mock test. Also on the Unacademy, we have something known as Plus subscription, where amazing access to live and recorded classes. Educators are good. You can watch myself on not on Netflix, but on the amazing what you call iOS, Android, laptop, iPad, and all those places. Then also we have Iconic subscription. In Iconic subscription, you have the Unacademy platform and the Prep Ladder subscription. All the amazing clinical notes, video lectures, question bank, everything you have of the Iconic subscription. And also for the new students, we have something known as Unacademy Lite. For the Lite students, we have for the NEET PG Unacademy Lite with the previous year question papers, and also with amazing grand test series for NEET PG, INI, CT, FMG and PYQs. हेलो स्वराज, हेलो निशी, हेलो वैदेही, हेलो सृजना, ओसामा, तबीयत कैसी है? मैं कॉल करूँगा दोपहर को. तबीयत कैसी है? ठीक है, अभी सुबह तो आया नहीं. ठीक है, let's start this beautiful class. And also for the MBBS students, we have started this amazing Prof 1 with duration prize and the pre-launch prize we have for pertaining to the next exam. The batch has already started. If you're a newcomer, download the Unacademy app and use it with the code Dr. Anand. Okay, इसको बुला देना थोड़ा सा वाजा को, ठीक है, पोछा लगा के बुला देना. And also on the Unacademy, we have this NEET PG previous year question bank. Basically, go to the app, click on self study, then practice, then subject, and give as many tests as possible. Also have starting with this auto daily practice papers, DPP, and I'm putting in the app itself, and you'll get a notification. That's it. If you're new to Unacademy, download Unacademy, where amazingly we have all the PDF notes you get. Everyone says I want lecture notes, please give me lecture notes. So these are the lecture notes you get, and also all the classes are properly synchronized. That's it. Let's start the class. I told you regarding the FMG high yield MCQ revision batch, basically from April 27 to May 27, only 1 month, and amazing faculties we have for you. That's it. Plus subscription, light subscription, and Iconic subscription. That's it. Let's start the amazing class. Okay, ग्रेट. हेलो ओसामा, हेलो स्वराज. ओसामा, ख्याल रखो अपना, एग्जाम बहुत पास में, अच्छे से ख्याल रखो. So yes, so before starting any beautiful segment, this is the second half of the image based revision of pediatrics. So this is something for all of us, for you, for me, for everyone on this planet. Body plus mind plus soul plus spirit is you. So make sure every single thing about you is amazing. Make sure your body is in the beautiful, is in the center. Your mind is very well focused, and your soul is the most beautiful thing you have ever felt, and your spirit is crazy. So always have these things ready in your mind. Okay, your body should be relaxed. Your mind should have a vision, because you need to have a vision. If you don't have a vision, means you don't have a plan, and you don't have a plan means you don't have a good life. You need to have a vision. I had a vision. I had to buy a BMW. I got a BMW. I'm the youngest in my whole generation who got the BMW. So I have a vision. So I had a plan, and I was doing for that. So you also must have a vision and must have a plan. So body, mind, soul, and spirit, and that's you. That's you. That's you. Remember that. Okay, that's you. Exactly. Yeah. Okay, let's start this class. Akhil is saying, sir, for the calculation of BP, the formula which you have given. Yeah, it is for more than 2 years, bro. More than 2 years and less than 12 years. Roughly more than 2 years बच्चों के लिए वो formula हम use करते हैं. Less than 2 years we don't use that BP वाला formula. We have a graph in our OP, guys. We follow that one. Okay, so let's start this amazing segment with very strong positive vibes. Next 30 minutes I want of yours. So what is this? What are the findings can we appreciate in this picture? Can you please tell me what are the findings if this comes as a NEET PG paper. Imagine today's NEET PG exam and this is the NEET PG question. The question is identify the image and give your best possible diagnosis you can think of. So what do you think, guys? Anyone? So Nishi Agarwal, very good. So can I say macrocephaly? Number one, prominent forehead. Yes, the baby has a prominent forehead. Can I say flushed cheeks? Flushed cheeks. And what was the other finding of this syndrome? Something known as pointed chin. Do you remember this? We have done this before. So very importantly, macrocephaly, flushed cheeks and pointed chin. And where do you see this problem? Osama Sheikh is very right. You see this problem in Soto's syndrome. Soto's syndrome. I am a NEET PG student. I am planning for FMG also. Could you please tell me what are the other points I should remember of Soto's syndrome? Any one more point? Any one more point other than macrocephaly, flushed cheeks and pointed chin? Do we have any other point which I should remember as a case of Soto syndrome? What do you think, Swaraj, Shagufta Praveen, Shubhangi Kaushik, Osama Vaidahi? The best answer will be LGA baby. Yes or no? Will this baby a case of large for gestational age baby? Do you remember that? Large for gestational age baby. The mnemonic was State Bank of India extra account. S for Soto syndrome, right? B for Beckwith-Wiedemann syndrome, I for infant of diabetic mother, and E for erythroblastosis fetalis, right? That's what. So I'll repeat again, Soto syndrome is one of the causes of LGA. What is LGA? LGA is large for gestational age. Can anyone please tell me what you called the formula or I would say definition of LGA? हाँ जी, कौन बताएगा? LGA is defined as, हाँ जी आगे आ जाओ ओसामा, आ गया आंसर बता. तू नहीं बताया देख तेरे घर पे आना मैंने, ठीक है. हाँ जी, LGA is defined as डॉक्टर शुभांगी एग्जैक्टली मोर देन 90th सेंटाइल. क्या मोर देन 90th सेंटाइल? मेरा सर, तुम्हारा सर, मेरे घर का डायमीटर, मेरी गाड़ी की चाबियां, क्या? व्हाट इज मोर देन 90th सेंटाइल? कैन यू प्लीज टेल मी व्हाट इज ओके. ऑप्शंस आर वेट फॉर हाइट और हाइट फॉर एज. एनीवन? वेट फॉर हाइट more than 90th centile or height for age more than 90th centile? What is more than 90th centile? I don't know what is more than 90th centile. Exam, anyone, what do you think? Yes, neither it is weight for height nor it is height for age, it is weight for age. ये शब्द important हैं, तभी यहाँ stress किया जा रहा है. These words are important. Okay, Pragya dear, no it's not height for age dear, no neither it is weight for height, it is weight for age. Weight for age more than 90th centile. Do you remember that graph we had? No, this side was the weight and this side was the age, and two centiles we have, one was 10th and one was 90th centile. Yes or no? So weight for age more than 90th centile will be LGA, weight for age less than 10th centile will be SGA, and weight for age between 10th and 90th centile is AGA, appropriate for gestation age. Perfect. Next question. Okay. Yes, where do you see telephone receiver femur? Can anyone tell me where do you see telephone receiver femur? Anyone? Yes, Shagufta, Shubhangi, Vaidehi, Osama, Rashmi. Yes, Swaraj and Pragya. Yes, telephone receiver, telephone. What is mobile number? Karunga type number. Sir, your option is like a wrong trap. Yeah, Dr. Benedict says, sir, your option is like a wrong trap. Yes, it is a wrong trap. Yes, but that's how it is. Okay. Yes, Hanji, beautifully told, amazingly told by Osama Sheikh. Very good. So yeah, perfect answer. Thanatophoric dysplasia type 1. My buddy Osama is answering really good. So please remember, we have two type of thanatophoric dysplasia, type 1 and type 2. In thanatophoric dysplasia type 2, the femur will be normal, whereas in type 1, you will have a telephone receiver femur. You will have a telephone receiver femur. Very important question. Yes, buddy, same here, Dr. Benedict. Yes. So telephone receiver femur is seen in thanatophoric dysplasia type 1, and in type 2 the femur is perfectly normal. Next question. Yeah.
Hello everyone, welcome to Clinical Pediatrics by Dr. Anand. Let's just
Hanji. So what is this? What is this picture? Anyone? We know this, right? This one. Yes. So what is this patient? We have done this before. What do you call it? Dr. Benedict, Swaraj, Panchal, Akhil, back to back, very good vibes, amazing strong vibes I want. Can you please tell me, okay, this one, this is a very beautiful picture. This is a case of dash. We have done this before. पहले कर चुके हैं 25 बार. Swaraj, Panchal, Akhil, what do you think, Akhil? Any Akhil wants to answer? Oxyhood. Okay, Nishi Agarwal is right. This is a case of holoprosencephaly. This is a case of Holoprosencephaly. So is holoprosencephaly a neural tube defect? The answer is yes or no. So that also we have done. Okay, someone says anencephaly. Payal, I'm really happy you're trying to answer, but it's more like a microcephaly with holoprosencephaly. It is not anencephaly. Anencephaly, the head will totally will be absent. Okay, so yeah, this is a case of holoprosencephaly number one. Single, yes, Suraj is right. Single eye with no nasal chamber. This is nothing but a holoprosencephaly. And is this a neural tube defect? The answer is no. It's not a neural tube defect. It is a forebrain anomaly. It is a forebrain anomaly. So this is a case of nothing but holoprosencephaly, failure of the forebrain to divide into two hemisphere. We have forebrain, midbrain, hindbrain. Forebrain divides into right and left cerebral hemisphere, and in between we have corpus callosum. So failure of the forebrain, yes, exactly, to divide into two cerebral hemisphere. Julie is saying कैसे हो? I am good, बढ़िया, सब ठीक चल रहा है. आप कैसे हो? Yes, सब चलाइव ठीक चल रही है. Okay, I'll show you. हाँ, exactly. It looks very dangerous and scary, dear, but yeah, this is again teaching. As far as clinical teaching is concerned, we are fortunate we are able to witness such cases, and they are important for exam purpose. Next one. Yes. What is this milestone? Anyone? What is this milestone? Can you please tell me? Tuck tuck like that. Exactly. रश्मि कह रही है बेबी ब्रीथ कैसे कर रहा है? बेबी अपनी आखिरी सांसें ले रहा है और वो एक्सपायर होने वाला है. हाँ जी. What is this? When can a baby say bye bye? Can you please tell me? Yes. A baby can say bye bye by 9 months. When can a baby say bisyllables? Anyone? When can a baby say bisyllables like ma or da? Anyone? Have you heard of monosyllables and you heard of bisyllables? Yes, monosyllables is saying only ma, ba, pa. So can you remember 6 and 9? Yes or no? 6 months old baby is say monosyllables like ma, ba, pa, like that. And bisyllables will say da, ma, or ba. Remember ba or bye. Bye also comes by 9 months, and ba, the bisyllables comes by 9 months. A baby can say bye by 9 months. Monosyllables by 6 months. Okay, next question. Yeah, what is this sign? Is nothing but a molar tooth sign. Can you please tell me where do you find molar tooth sign? Very simple question. We have done this multiple times. Yes, very good, Dr. R. Nishashri. Amazing, beautiful answer. Panchal, Rashmi, Srujana. Yes, amazing. Let's finish the whole topic. Okay, yes, exactly. Priya is right. Molar tooth sign is seen in Joubert syndrome. Molar tooth sign is seen in Joubert syndrome. Like an MRI picture, in between you have the molar tooth sign seen in Joubert syndrome. Next question. Yes, this is also a very old question. Eye of tiger sign. These are the eyes of tiger. And remember, this is a MRI picture. Eye of tiger. Yeah, like a eye of tiger, right? Eye of tiger sign. Where do you see eye of tiger sign? Photographic memory. Anyone? Osama, Surujana, Vaidehi, Rashmi, Shagufta, Shubhangi, Arpita Pancholi. Yes, eye of tiger sign. Basically, it is seen in PKAN. It is seen in PKAN. What is PKAN? Pantothenate kinase. Pantothenate kinase associated neurodegeneration. Pantothenate kinase associated neurodegeneration known as PKAN. Exactly. Yes, exactly. Yeah. Okay, so that's what. So pantothenate and is also known as Holoprosencephaly syndrome. It is also known as Holoprosencephaly syndrome. This is a rapid revision of pediatrics, so I'll be just revising the whole topics in depth and detail. We have done that. Okay, eye of tiger sign. It is seen in PKAN. PKAN is pantothenate kinase associated neurodegeneration, and the other name of PKAN is everyone knows about it. Shagufta, Arpita, and Osama is answering nothing but Holoprosencephaly syndrome. Holoprosencephaly syndrome. Next, yeah, this is a very good question. This one I will not tell. Who will tell? It's a very good MRI with this scan picture. Which sign do you call this? Exactly. वो कहाँ है? Yes, Dr. Julie, what do you think? What is this sign? It's a very important sign. Dr. Priya, Rashmi, Akhil, bro, what is this one? Finish it off. Image based, image based. My whole life is always about image based. क्या बोलते हैं इसको? ये क्या? Okay, if I show you the next picture, you'll automatically tell me the answer. This one. ये कैलकाटा की ट्रेन्स क्या है? ये कौन बताएगा? मुझे भी नहीं पता. डॉक्टर पांचल, शगुफ्ता, अर्पिता, वो कहाँ है? अखिल कहाँ है? अखिल, व्हाट डू यू थिंक? पंखा चला दो प्लीज, 2 नंबर. So Akhil, what do you think? Punched out lesions. So bro, yes, exactly. So this one is tram track appearance. Tram track. That is nothing but tram track. You remember Calcutta trains like a tram track appearance. So where do you see tram track sign or tram track appearance? Can we see that like this ऐसे like that is there? No, it's nothing but tram track. अच्छा मेरे बोलने के बाद 25,000 लोगों को याद आ गया कि हाँ हाँ मुझे पता है, मुझे पता, हाँ हाँ मुझे याद था ये tram track, कि मुझे याद था. हाँ तो tram track. Where do you see tram track sign? There are 7 conditions. There are 7 conditions where you see tram track appearance or tram track sign. So can anyone tell at least one of them? एक okay, Pile says railroad sign. Very good. I'm happy. I'm happy you didn't say this Shatabdi sign or this, yeah, exactly. Perfect. The best answer for this is SturgeWeber syndrome. Okay, tram track sign basically it is seen in multiple conditions. Tram track sign it is seen in multiple conditions basically. One of the important condition is SturgeWeber syndrome, our neurocutaneous syndrome, basically that neurofibromatosis and this one which is known as von Recklinghausen disease. So tram track sign is seen in number one SturgeWeber syndrome, CNS में. CNS में it is seen in SturgeWeber. There will be a cerebral cortex calcification seen in SturgeWeber. Then also we see in the eyes also, in the optic nerve sheath meningioma. There are 7 conditions. Please remember exactly. Put your very good vibes over here and finish it off in 30 minutes. There are 7 conditions where we see tram track sign. Number one, Sturge-Weber syndrome, CNS में calcification. In the eyes, we have optic nerve sheath meningioma. We have optic nerve sheath meningioma in the eyes. Okay, and again in the lungs, basically in a case of bronchiectasis. In a case of bronchiectasis, we see very importantly tram track sign. I'll repeat again. Let's revise here only. Exactly. Huh. मल्टीपल स्क्लेरोसिस में बताता हूँ अभी. सो नंबर वन इज स्टर्ज वेबर, नंबर टू इज इन रेस्पिरेटरी साइन इन pulmonary edema, and also in the bronchiectasis you see very important in the eyes in the meningioma, in the RS in the pulmonary edema or bronchiectasis, and also abdomen necrotizing enterocolitis. In the previous morning 9:30 class we covered about the NEC necrotizing enterocolitis. There also you can see a tram track sign. So again can we revise? Number one was the brain, Sturge-Weber syndrome. Then comes the eyes, our optic nerve sheath meningioma. Then come the chest, our bronchiectasis. Then comes little abdomen, our necrotizing enterocolitis. Then come little our what you called our kidney. So membranoproliferative glomerulonephritis, MPGN type 1. Basically there is a basement membrane duplication appears in the light microscope as a tram track in the light microscope, basically in MPGN type 1. Okay, so can we please revise again? Number one is Sturge-Weber. In the eyes it is optic nerve sheath meningioma. In the chest it is bronchiectasis. Then down you go stomach, NEC. Then side we have kidney, that is MPGN type 1. And also in breast also we have in the duct ectasia, in the mammography, in the mammary gland, in the mammography we have something known as duct ectasia. There also we see tram track sign. So we have brain, we have eyes, we have chest, we have abdomen, we have kidney, and we have the apna breast. That's important. Okay, that's what. So I hope you have got it. Did you understand, everyone? Please put a like button. समझ में आ गई कहानी के नहीं समझ में आई? I hope you have got it. Osama, समझ में आ गया? यहीं खत्म करना है. We have to revise here only. Okay, don't think I will go home again. I will revise properly. Finish here only. Great. So what when we see in this picture, can you please tell me? It's a very beautiful picture. Yes, it's a typical case of the intestinal contents are out, but they are not covered in a sac. So this is nothing but a gastrochysis. This is a typical picture basically of a case of gastrochysis. When the intestinal contents are out and they are not covered in a sac, is nothing but gastrochysis. And what is this one? Anyone? What is this picture? This picture also, yeah, without sac. This picture also same. So try, you're very lucky we are doing this image based questions, because everything is very realistic, clinical, real picture of a patient. It is not just a cramming theory book. It's like literally seeing the real patient. So you will definitely see these patients in your future life for sure. This also is a case of gastrochysis where the intestinal contents are out but are not covered in a sac. Okay, I have a question here. If I have to refer this patient, if for example this patient had come to my hospital and I don't have a pediatric surgeon with me, so I will refer the patient to AIMS. If I'm referring this patient, can anyone please tell me like how do you refer this patient? ऐसे ही उठा के refer कर देंगे, or there is some specific way of referring this patient? Who will tell me? Rashmi, Panchal, Shagufta, Arpita, Nishi, Rashmi, yes. Swaraj, very good. या हाउ डू यू रेफर दिस पेशेंट, ये पेशेंट को मुझे एम्स भेजना है, हमारे हॉस्पिटल में सर्जरी डिपार्टमेंट नहीं है, सो हाउ डू यू वांट टू रेफर दिस पेशेंट? आई विल नॉट टेल द आंसर, इट्स अ रिवीजन, राइट? Okay, okay, fine, I agree with you, there was a Bogota bag also, I have also have seen that, but in general if you want to refer this patient, if you are in a very periphery and you don't have a Bogota bag, so basically this was the AIMS question, this was the AIMS question they had asked recently. Remember, you'll take the normal saline and you'll take the gauze piece, take the normal saline and take the gauze piece. So you soak the gauze piece with the normal saline, you soak the gauze piece with the normal saline, okay, and then basically you will, what you call, you will put on the patient's defects, wherever the open defect is there, wherever the open defect is there, with this, with the gauze piece soaked, भीगी हुई, soaked मतलब भीगी हुई, soaked with the normal saline, you will put on the whatever defect. Even if this patient was a case of meningocele, then also you refer like that only. Why should I keep it? Can anyone please tell me why should I do dressing of this patient, or at least with a, why should I cover this defect with a gauze piece soaked with a normal saline? Of course, to prevent the dryness, to prevent the trauma, basically to prevent the infection. So dryness, trauma and infection, dryness, trauma and infection are the three important things basically you want to avoid that. That's why you are doing like this. Okay, what is this case? This everyone knows. This also, intestinal contents are out, but they are covered in a sac. When they are covered in a sac, this is known as omphalocele. This is known as omphalocele. And other than this, contents are out and not out is right. Do we have any other difference between gastroschisis and omphalocele? Osama batayega. Osama, do we have any other difference? One, I understood intestinal contents are out without a sac is gastroschisis. Within a sac, if it is there, that is omphalocele. But do we have any other important what you called highlighter here? So most importantly, liver and spleen. Liver and spleen also can be seen coming out in a case of omphalocele, whereas liver and spleen will not come out in a case of gastroschisis. That is very important. This part is over. Acha, extra point, Hanji, that's true. Cleft lip and palate, and very important. What is this? What is this? A very nice finding. It's a very important finding. What is this? Can anyone please tell me? ये मैंने arrow क्या करा है? Yes, very right. Okay. Yes, very true, very true. This, can I write something known as acrocyanosis? Acro means periphery and cyanosis means fluid discoloration. Yes or no? Yes or no? Yes. So acro means cyanosis, and acro means periphery, and cyanosis means fluid discoloration. Acrocyanosis is given in which point of Apgar score? If I have to do Apgar of this child, will I give 0 for acrocyanosis, 1 for acrocyanosis, or 2 for acrocyanosis? What do you think? So how much should I give for the acrocyanosis in an Apgar score number 1? Yes, what do you think? Arpita, Shubhangi, Julie? Yes, I will give 1 score, 1. 0 will be when the baby will be totally blue. The child is dead almost. That's like a 0 Apgar. The baby is totally cyanos, totally blue. The Apgar will be 0. When the peripheries are blue, only the palms and soles are blue, but the body is pink. That is Apgar 1. And if the baby is totally pink, then the Apgar is 2. Aryan, I will tell you about hyperhidrosis. Once we finish this topic, I will definitely tell you about the hyperhidrosis. Okay. Next important point. This one also is over. Yeah, it's a very cute picture. What do you think? This patient had come, all my OPD patients, these all are my OPD patients. Like from last 3-4 years, I'm collecting pictures here, everywhere. Yes. What is this? Yeah, it's a very beautiful picture of geographic tongue. Have you heard of geographic tongue? Have you heard of beefy tongue? Have you heard of strawberry tongue? So geographic tongue, basically, this is kind of a एक नक्शा बनाया हुआ है चेहरे पे. तो yeah, on the tongue, so it's a geographical tongue. Usually it's because of folate deficiency, vitamin B12 deficiency. In general, we can say these deficiencies can basically cause geographic tongue. Macroglossia थोड़ा सा इतना नहीं है, लेकिन हाँ, स्कूल का इसका भी, she has a eye card right now on her head. So she has just come back from school by this thing. So we gave her a multivitamin and iron also. She was perfectly fine. So nothing but a geographic tongue. Yes, exactly. Swaraj is right. Strawberry tongue you see in Kawasaki. Other than Kawasaki, where else do you see strawberry tongue? Strawberry is in scarlet fever, right? Scarlet fever. So strawberry tongue you see in Kawasaki and scarlet fever. And here you see geographic tongue. That also is easy. And that's it. And I hope you know all the tongue. Strawberry vagina, strawberry skull, everything. Julie knows everything. So we will shift to the next one only. Yes. What is this now? Anyone? What is this one? Yeah. If you see this picture, what do you call this problem? Is this perfectly fine? Exactly. So this is nothing but very importantly क्या बोलेंगे इसको? Yes, Pragya, very true, dear. Hmm. Yeah, just clubbing, or you will say pan digital clubbing. This is nothing but pan digital clubbing. Can I say clubbing in all the hands? So pan digital clubbing will be a better answer for this. For clubbing, I have two questions to ask you. Okay, two very nice questions I want to ask you. Number one, my question is, see, everyone knows that there's a change in the obliteration of nail and nail bed angle. Normally this is the normal, okay, this is the more than 160-degree normal seen in a patient, but here is the clubbing, that there will be change in this angle. Okay, very beautiful picture. The nail and the nail bed angle obliteration will be there, no, in a case of clubbing, right? My question over here is exactly, my question is, which grade of clubbing has a parrot beak appearance? The options are grade okay, the options are, what should I ask? So easy वाला ही पूछ लेता हूँ. Options are grade 1, 2, 3, 4. Which grade of clubbing basically has a parrot beak appearance? Okay, so Mohammed Samad says grade 2. Surajna says grade 3 and Meta Zillo says grade 4. सारे ही हो गए खत्म. किसी का मन है तो grade 1 भी बोल दो बैठे बैठे, है ना, सारे कवर हो जाएंगे. So the parrot beak appearance is seen in grade 3. In the grade 3 of the clubbing, you see parrot beak appearance. See, obliteration of the nail bed angle definitely will be nothing but grade 1. And obliteration of the lobby bond angle, grade 2. Parrot beak appearance is grade 3. And pulmonary hypertrophic osteoarthropathy is basically seen in grade 4. It is seen in grade 4. So yes, exactly. Grade 3 is important. This was the exam question. In which case you see parrot beak appearance, the answer is grade 3 clubbing. Next question. What is this sign? What is this sign? When I do like this, it's a very beautiful, please guys, photographic memory and clinical knowledge. I'm trying my best to shift your whole books into clinical orientation, everything. Okay, so if I do like this, okay, if I do like this, I can see a diamond. I can see a diamond over here in between my, what do you call it, fingers. But this obliteration, this finger is clubbed. क्या बोलते हैं इसको? Exactly, this is known as Shamroth sign. So it's a very beautiful sign known as Shamroth sign. SCH, yeah, Shamroth sign. So obliteration basically of this angle leading, and I can't see a diamond properly inside. So Shamroth sign is important. Okay, what is this? Anyone? Exactly. What do you call this? Yeah, this patient comes to my OPD, and once I go back home also, his area where he stays, I have seen him multiple times. Hmm. Exactly. That's right. That's right. Yeah. So it's a congenital CTEV. Kavya Reddy is very right. It's a congenital CTEV. It's a case of congenital talipus equinus varus deformity, nothing but clubfoot. So yes, this looks like a clubfoot only to me. It's a congenital CTEV patient. Okay. Next question. Yeah, this also. Very beautiful. This is my patient only. Very beautiful. CTEV. Can we see that clubfoot? Very beautiful. Can we appreciate this picture? Yes, clubfoot, clubfoot. One more picture. I think I have this one. Can we appreciate this? Yes or no? Clubfoot, very important. Yes, congenital. Osama Sheikh is very right. Congenital talipus equinus varus deformity. Clubfoot. Very, very true. Next question. Very easy cannula numbers. Blue color cannula is which number? Can anyone please tell me? Blue color cannula is which number? Shagufta, Osama, Akhil, yes, Akhil, answer. Akhil, you come very less to my classes, no? Once in a blue moon you comes, and but once you come, your name is always spoken. Okay, so yes, pancake, Rashmi, what do you think? Yes, the treatment, surgical treatment, Dennis Brown splint and surgical treatment are there. Blue color cannula is which number? Okay, so the options are 16 or 18. So, okay, the answer is neither 16 nor 18, it is 22. Blue color cannula is 22. Yellow is yellow. Okay, we have Neil saying, hey, how are you, sir? I'm good, buddy. I'm good, Neil. How are you? आप कैसे हो? 24 is yellow. That's right. What is purple? Purple वाला या violet वाला कौन सा होता है? That is 20. Yes, 6. That's true. What about gray green? What about gray and green? Can anyone tell me? I really forgot. Gray and green कौन से colors का होता है? So, do you remember 16 or 18? 16 or 18 is nothing but gray green. Gray green 16, 18. Okay, yes, this is very important. So remember this, blue is 22, yellow is 24, violet is 26, gray 16, green 18, This part is over. What about pink? Now tell me pink. Pink is which color? Anyone? Pink color cannula. Already someone has told pink is 20. Which of the color cannula is a odd number? Which of the color cannula is a odd number? Like 16, 18, 20, 22, 24, 26. So many we have covered, okay? So odd number वाला कौन सा होता है मेरे को नहीं पता. Osama bro, what do you think, Kavya? Shagufta, odd number. Yes, odd number is our white. White is 17 number. White is 70. Yeah, Akhil is very, very right. So please, can we therefore appreciate? And what about orange? I think orange is 14. Yes, orange is 14. So can we please appreciate 14 is orange, gray is 16, green is 18, blue is 22, yellow is 24, violet is 26, pink is 20, and white is 17. ठीक है? Has everyone understood this much? Please put a like button to this video, or please you can give a golden heart or a blue heart or a black heart. This is very important. Gray, green, 16, 18 is important. Odd number is white is important. Even in the AIMS paper they were asking the flow rate also. Some student told me that sir AIMS में तो flow rate भी पूछा हुआ था, वो तो भगवान ही मालिक है भैया उसके बाद तो flow rate तो मुझे पता नहीं. Perfect. Let's move further. Okay, Anil has given a heartbreak sign. Why heartbreak? Why not full heart? Can we move further? Okay. So always remember, in life there is nothing known as right time. There is nothing known as right time. Next Monday I will start studying. Next week pakka my friend's internship is getting over. Then definitely I'll start studying. ठीक है, एक बार मैं mood बन जाए मेरा 4-5 दिन, then definitely I'll start studying. So there's nothing known as right time. This is the time. This is the time which is right. If you use this time wisely, then this time becomes your right time. There's nothing known as right time. Tomorrow I'll talk. Okay, next week pakka, next week I'm sure I will start going to gym. So there's nothing known as right time. This is the time which is right, and if you use this time wisely, then this time becomes your right time. Remember that. Okay, great, perfect. That's exactly. Nishi Agarwal is right. Nishi says we can remember this. Nishi has a point. Nishi says about this one. Okay, 1 second. Yeah, Nishi says we can remember this signs basically by the order of the sun: yellow, sky blue, pink, flower, green, stem, gray, gravel, orange, lava. And then someone else messages, भाई निमोनिक्स को याद करना एक बहुत ही बड़ी बात है. So yes, that's true. It's fine. ऐसे ही हो गया याद ना, ऐसे ही हो गया. So no problem. Yes, exactly. 2 गज दूरी मास्क है जरूरी. That's right. याद है बीच में वो आता ना पहले. डू रिमेम्बर बिफोर अमिताभ बच्चन दैट वन गर्ल शी यूज्ड टू स्पीक, बट शी विल बी इन फ्रॉम द नॉर्थ इंडिया, यू वॉन्ट बी नोइंग. वो बड़ी अच्छी आवाज़ होती थी उसकी. ये थी कि अपनों की रक्षा करें, 2 गज दूरी मास्क से बचें, ऐसे करके शी यूज्ड टू से. यस एग्जैक्टली. सो परफेक्ट. नेक्स्ट क्वेश्चन, व्हाट इज दिस वन? कैन एनीवन प्लीज टेल मी? अच्छा, आर्यन यादव हैज स्टक हिमसेल्फ. सर, डायग्नोसिस ऑफ हाइपरहाइड्रोसिस. I don't know the diagnosis of hyperhidrosis, Dr. Aryan Yadav. I will read the diagnosis of hyperhidrosis, make 5 beautiful points, and then share you in the next class. Will that be fine, Dr. Aryan Yadav? Thank you. God bless you. Okay, yes, what is this sign? This is nothing but very important, butterfly rash. Very beautiful sign. We have seen this multiple times. Yes, butterfly malar rash seen in systemic lupus erythematosus. है ना, याद रखिएगा. Beautiful. So Akhil is right. Butterfly malar rash seen in SLE, a typical image-based question. And also, when do you celebrate World Autism Day? नहीं, slapchick नहीं है. Slapchick, I agree. The Sonal says looks like a slapchick appearance, but no, this proper butterfly. Slapchick will be only here, okay? Butterfly will be here. It is in nose also. Nasolabial folds. Can I appreciate the nasolabial folds? So you have the rash in SLE in the nasolabial folds also, whereas slapchick appearance only over the hair. Slapped cheek appearance, okay? Yes. World Autism Day. Someone said 2nd April. Who said this right answer? Very good. Arpita Pancholi, friend of Suraj Pancholi, is very right. So World Autism Day you celebrate on 2nd of April. It's important, okay? World Autism Day, and rest all 10 days. I hope you know it. I will not ask you again. Okay, and and remember 18th June you celebrate Autistic Pride Day. Autistic Pride Day you celebrate on 18th June. Do we have Julie on the stage? Julie, could you please tell us when do you celebrate National Neonatology Week? National Neonatology Week. हाँ जी, yes, हाँ. मैं हूँ ऐसा, क्या करूँ बताओ. Dr. Julie, could you please tell us? Dr. Julie will only tell us about this. Yes, what you called क्या था वर्ड नेशनल न्यूनेटोलॉजी वीक, अभी रिसेंटली हमने सेलिब्रेट किया था. सो एनीवन, व्हाट डू यू थिंक? एनी रैंडम गेसेस? Dr. Julie Tugadi from Siddhivinayak Temple. Rashmi सृजना नेशनल न्यूनेटोलॉजी वीक. अच्छा, फर्स्ट वीक ऑफ नवंबर. शादी थी तुम्हारी फर्स्ट वीक ऑफ नवंबर में. फर्स्ट वीक नवंबर क्या है नवंबर? ना मेरा जन्मदिन आता ना तुम्हारी शादी, तो कैसे हो गया ये नेशनल न्यूरोलॉजी वीक? द आंसर इज 15 टू 21 ऑफ नवंबर. ठीक है, 15 टू 21 ऑफ नवंबर इज नथिंग बट नेशनल न्यूरोलॉजी वीक. यस, फिफ्थ थोड़ा लिटिल बिट डेट्स आर इंपॉर्टेंट. डॉक डर्म, इट इज 5-6 डेट्स आई वांट यू टू रिमेंबर. ओके, yeah, please interpret this picture. This is a patient, a 5-year-old baby came with this problem. So basically this is the blood finding. Could you please tell me exactly? स्वराज कह रहा है मेरा जन्मदिन आता है. कब आता है ब्रो तुम्हारा जन्मदिन, बताओ. मुझे याद रहेगा. आई एम वेरी बैड विद बर्थडेज, बट मुझे किस तरह याद दिला देना. Exactly. हाँ जी. So what is this? Could you please elaborate this picture? This patient has come to us with this finding. Exactly. Beautiful. This is a picture of macrocytic anemia. Yes, macrocytic hypochromic, not hypochromic, at least macrocytic picture. So everyone knows about it. The first question I need to ask the child is, are you vegetarian and are you pure non-vegetarian? Because usually megaloblastic anemias or vitamin B12s are usually rich in the animal products food. They are not in the vegetarian's food. Okay, okay, Swaraj. Okay, Swaraj Suman. Okay, cool. Yes, very beautiful question. Very beautiful question. A 5-year-old boy came with the father says there is a change in the voice of the baby. The child is little quiet. Okay, the 5-year-old boy, exactly. Okay, Swaraj Suman, because your name is Swaraj, no, so I thought that you're a boy. Okay, your name is Suman, so then you're a girl. Yes, okay, now I'll remember. Okay, now I'll remember. Okay, वो स्वराज होता है तो आई थॉट दैट्स व्हाई. हाँ जी, एग्जैक्टली. सो यस, सो जूली तिगड़ी फ्रॉम सिद्धिविनायक. यस, इट्स ट्रू. So Hanji, a 5-year-old boy with a voice change, with that father says is too much quiet. I got an X-ray done. Very beautiful. कहाँ चला गया? Yes, very beautiful. The patient has a 5 rupees coin stuck here on the throat. So the best answer for this question will be immediate endoscopic visualization and removal will be the best answer. Next question. Everyone knows the dose of ADR. That's very well true. Okay, perfect. Yes, and then blue color candle is over. So scared of mistakes. Are you scared of mistakes? Are you scared that if you know exactly? Okay, Osama कह रहा है मुझे भी लगा स्वराज बॉय है. सबको लगेगा स्वराज बॉय है ना, स्वराज नाम ही बॉय वाला है. तो सुमन इज द नेम होता है ना. आई थिंक फादर नेम या सेकंड नेम भी लगाते हैं. वन ऑफ माय क्लोज फ्रेंड इन माय MBBS टाइम, हर नेम वाज अंचन विद्याश्री विट्टल. So Vidyashri was her father's name, Vittal was her surname, and Anchan was her name. So it happens that way. Okay, fine. So scared of mistakes. Are you really scared of mistakes? Yes or no? Do mistakes. Do lot of mistakes. Why? Why, sir? Because mistakes are a proof that you are trying. Mistakes are a proof that you are trying. So you must do lot of mistakes. You must do lot of mistakes. I don't know who's calling me so many times. I hate people who call me. So yeah, scared of mistakes. Are you scared of mistakes? Do mistakes, lot of mistakes, because mistakes are a proof that you are trying. Remember, okay? Yes. Now coming to the ibuprofen syrup. Very beautiful ibuprofen syrup. Can you please tell me at least three? Okay, at least three. Okay, let's have a very beautiful talk show of this one. Exactly. So okay. So Raj says, actually I am a single child of my parent. So boy slash girl name mix up. Swaraj Suman. That's cute. That's amazing. That's very cute. Exactly. हाँ जी. Yes. Okay. Okay. So Rashmi Kumari, बात सबको बातें करनी, सबको बातें करनी है. Okay. Rashmi Kumari says, sir, if one name is Sushmit Anand, what do you think? This is a boy or a girl? Sushmit Anand. I think boy only, no, bro. Sushmita Anand. Sushmita Anand. Then I will ask that person only, are you a boy or a girl? Sushmit Anand is a boy. Sushmita Anand is a girl. And yeah, very cute. हाँ जी. ओके. सो अर्पिता सेज हमें भी दे दो नंबर अपना. हाँ जी, ले लो नंबर, हर जगह नंबर है मेरा, कोई प्रॉब्लम नहीं है. हाँ जी. सो दिस इज नथिंग बट अ केस ऑफ अ पिक्चर ऑफ ibuprofen. Number 1, can I use ibuprofen as a painkiller? Yes, definitely. You can use it as an anti-analgesic, even antipyretic also. And very, very important point. Can you please tell me that what you called one of the important exactly Swaraj is right. Suman is right. The ibuprofen will help in keeping my PDA open or keeping my PDA closed. The answer is it will help in keeping my PDA close. And also in a case of juvenile rheumatoid arthritis, can I give ibuprofen in a case of rheumatoid arthritis patient? Definitely you can give, no, because rheumatoid arthritis so much of painful joints with no residual deformity. Again someone called me. इतने सारे phone. One second, no? Hello. हेलो. आपकी ना आवाज़ कट रही है एक्चुअली. मैं एक क्लास में हूँ, ऑनलाइन क्लास में. मैं आपको आधे घंटे में कॉल करूँ? एसडीओ ड्यूटी, अच्छा ये कब हुआ? अच्छा, या नो प्रॉब्लम, आई विल डू इट, बट आई वाज नॉट नोइंग आई एम ऑन एसडीओ ड्यूटी. हाँ, आप मुझे एक बार व्हाट्सएप कर दीजिए, मैं एक बार देख लेता हूँ, है ना? हाँ जी, हाँ जी, ओके जी, ओके, थैंक यू. आई थिंक आई एम ऑन सम ड्यूटी टुडे, इट सीम्स. Okay, yes, that's right. You will give what you call to close the PDA. That's right, very right. So this part is over. Then next one, yes. So this one, what is this milestone? Yes, very nice picture. Can we please appreciate this? Exactly which milestone is this? This is nothing but very importantly Jargon milestone. This is a Jargon milestone. Again, someone called. Hello, hello. Jargon milestone. This is nothing but Jargon milestone. So what is this Jargon milestone? Jargon milestone is nothing but very importantly that using this comprehensible sounds, a baby, while using this sounds basically known as Jargon milestone. And when does Jargon milestone comes? Jargon milestones comes by 15 months. Jargon milestones comes by 15 months. That you should know. Okay, that's it. And one more picture, let's have it. Exactly. If I show you this one, yes, exactly. If I show you this slide, so what is the age of this baby? What is the age of this baby? Can anyone please tell me what is the age? Is this baby is okay? Options are this baby is 1 year old, this baby is 2 year old, this baby is 6 months old. This is the last picture of the slide. What do you think? What is the age of this baby? So yes, can we see two carpal bones over here? Only two carpal bones. So what is the age of this baby? Any random guesses? Yes, that's right. The first card, so you know that like she looks too pretty, try to catch her. The capitate is the first bone to appear in a baby, comes by 2 months, and then comes the hamate, which comes by 3 months. Okay, so at least by 2 months capitate comes, by 3 months hamate comes. Okay, so at least these two bones are there, capitate and hamate. So I assume that this baby is roughly around 3 months old. Definitely 3 months old, because capitate and hamate is something I can appreciate in this picture. So this baby is definitely more than 3 months old, number one. And number two, I can see this one. What is this? Cupping, fraying and splaying appearance. Can you see that this part, this one, this is nothing but cupping, fraying and splaying appearance, very important. So this is nothing but very important, cupping, fraying and splaying. And where do you see that? You see that basically in a case of rickets. These are the x-ray findings of rickets. That's it. Okay, so that was all about today's second half. See you after the third half of the session, roughly around 3 o'clock. And I got the call from hospital that I have some duty, so let's see which duty I have. Okay, thank you so much everyone. Please take care, and see you soon with the next set of questions. And I have to go, I have to do some work. Bye bye, take care, study well, and see you very soon. Okay.